Hello everyone, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. Today we're going to be talking about feline lower urinary tract disease and inappropriate eliminations and inappropriate litter box behavior in our cats. A lot of our segments have revolved around dogs, and I wanted to give a lot of our cat owners some more information because cats are very vitally important in our practice, and they're a very vitally important part of our families, and a lot of times cat care and cat health topics get overlooked. The cats that are chronic offenders of inappropriate eliminating outside the box tend to be our young male cats or our middle-aged male cats. And inappropriate eliminations for cats are sort of broken into a few different segments. The one being behavioral inappropriate eliminations, where there's actually no medical reason behind it. There's just purely a behavioral complex. And a lot of those behavioral complexes in cats can arise because of previous experience in the litter box, whether they didn't like an experience they had in the litter box, they don't like the substrate, or they don't like the litter that they're using, they don't like the box, they don't like that it's covered, they like a covered box versus an uncovered box, it's in an inappropriate place in the house. Those would be considered sort of the behavioral reasons. And if a cat develops a litter box aversion, and that's what we call it when they go away from their box, we need to try to implement a strategy right away to try to get those cats in the box. Good options would include trying a different type of litter box than what you have, always making sure that you have 1 plus however many cats or litter boxes you have in the house per cats. So if you have 3 cats, you should have 4 litter boxes. I know that sounds like a lot. Sticking with either a clumping or a non-clumping litter, depending on what your cat has been used to, and maybe they're having an aversion to it. Maybe you need to switch up the type of the litters. So giving them a different litter from what they're used to, versus whether it's clay-based or whether it's clumping or non-clumping. Give them something a little bit different, and maybe that might get them back in the box. Another really good idea is sometimes mixing an organic substrate like sand, something like sand and a little bit in the box, sometimes makes it a little bit more curious for them and gets them into the box. Another major reason that I see a lot of cats going outside their boxes is that the box is dirty and it needs to be cleaned more frequently. So try cleaning those boxes once a day and making sure they're clean. And a lot of cats, they're like us, they want to be clean. They don't like going in a dirty litter box. So try to kind of give your cat a little bit of a litter box smorgasbord, so to speak, or a litter box buffet, and give them different kinds of litter, and that sometimes will help get those cats back in the box. Now, the sectioning off from behavioral things to more medical issues, a lot of cats, and especially a lot of our young male cats, will be going outside the box because they have what's called feline lower urinary tract disease, where their urethra actually gets inflamed, and it becomes inflamed for a variety of reasons, and there's actually no good scientific basis for it. There's no good information out there. It's called idiopathic in the veterinary community. Idiopathic meaning we don't know the cause for it, but they'll eliminate outside of the box because they have this inflammation in their urethra. A lot of those younger male cats, like I said, they're having that lower urinary tract syndrome where their urethra is flaring up. That's a very common condition. Another reason for that too is a lot of cats will develop what's called crystal urea, and they actually will form crystals in the urine of in their bladders. Cats are incredibly efficient at concentrating their urine, and when that urine is so concentrated and there's so much stuff and so many solutes in the bladder, it's very common to see little fine crystals, and we'll see that very, very commonly in young male cats because their kidneys are so efficient, and their urethra on a male cat's a little bit longer and it's a little more narrow, and those cats tend to have problems. Those can be emergency situations if the urethra gets blocked with those crystals, and a male cat, if you see a young male cat that is going by the box that is trying to go and they're not having any urine coming out at all, that is an emergency situation, and you need to call St. Paul Pet Hospital immediately, or you need to get hold of an emergency veterinarian immediately. If you see a male cat by their litter box, a young male cat trying to go to the bathroom, that is an emergency situation that has to be dealt with immediately. That can cause serious complications, even sudden death if it's not addressed very, very rapidly. And then the other, so moving on sort of beyond our young male cats, then we have some of our, our female cats that are inappropriately eliminating, and those tend to, not that they tend to be more urinary tract infections, but more commonly we'll diagnose urinary tract infections in our female cats versus our male cats. It is very, very rare that a male cat develops a urinary tract infection, where it's much more common that a female cat will develop a urinary tract infection just because of the overall anatomy of a female versus a male cat. And I would say if you're seeing more than 2 inappropriate eliminations in a day, really for any cat, a veterinarian should take a look at them and be able to hopefully help diagnose that issue and collect a urine sample on them and further diagnose what is going on. So I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. Hopefully that information helps a little bit. And if I don't see you in the clinic soon, I hope I see you around the great city of St. Paul. Thank you very much.